Today I want to talk about plantar fasciitis. It's one of those very common issues that dogs, most athletes, runners, people like to walk. It's often a problem of contracted fascia and muscles from the base of the foot and up along the calf muscles and even the hamstrings. One thing people don't realize is that the foot has 26 bones in it. And so there's more bones in one foot than the whole spine. And so those have to move just right. And then there's the talar joint, which is the ankle joint, which often can get out of alignment, especially if you've ever twisted your ankle. And then there's all the muscles of the foot. There's a lot of them. And there could be the plantar fascia itself, which is a connective tissue over the top of everything. But then there's a plantar fascia ponderosus, and which is the muscles at the bottom of the foot. And then all the flexor muscles of the big toe, which is huge and literally huge. And it goes up the leg and has to propel you forward. So that needs to be working right. As well as the glutes, the glute max. Also between those two is what really propels you forward. So so when somebody comes in with plantar fasciitis, I'm looking at all of this. The alignment has to happen from the pelvis down to the knee, the ankle, the foot, all those bones, and then all the muscles that are involved with the glute max and the hamstrings, the gastrocnemius, the muscles of the flexors of the big toe and the small toes as well. And all of this has to happen. And then there's gait, which is the right-left motion between the legs and the arms. And that also involves the abs and the core and the low back muscles and what the head is doing. And so the whole body is involved. So if somebody comes in with plantar fasciitis, I can't just knock out plantar fasciitis. I need to correct everything and then knock out the plantar fasciitis. So I'm going to be showing, just a little bit of the anatomy, but basically in the following videos, I'm just going to show not the actual treatment for plantar fasciitis, but at the end, what I do to help knock out the actual inflammation. I'm going to be using shockwave and Graston type work, as well as taping, kinesiology taping. Sometimes I'll even add in ART, cupping, and then stretching for home use as well. When I'm using shockwave on the foot, I use different heads. I'll start with a larger size head, which covers more area and is more diffuse, so it's not as intense. You'll notice that I'm going from the heel up along the plantar fascia and even up to the top of the met heads. I may go to the outside of the foot, the inside of the foot, the arch, and whenever I find an area that's particularly spicy, that means that's where the adhesions are, and we can sit there for a little while. You notice here I'm actually moving the foot in motion, which will make it more efficient as well. And then I'll even go up into part of the Achilles tendon. When addressing plantar fasciitis, I've also found it very useful to also address the Achilles tendonitis or Achilles tendinosis, which is the tendon at the base of the gastrocnemius and soleus. And when that's tight, that can also lead to the plantar fasciitis issues. So we definitely want to cover that as well. Sometimes it's nice to go either before shockwave or after to use a beveled surgical steel tool that is known as Graston or as Factor. These are all specific industry names, but it just literally is ironing out the connective tissue, and so it's just a nice way to more grossly kind of work through adhesions as well. The last bit I'm going to show you is how I might use kinesiology tape or rock tape to follow up a treatment. So what I'm doing is I'm laying kinesiology tape, I happen to like rock tape, down on the base of the foot, starting at the met heads. And I'm putting a little bit of pressure. I'm stretching the fascia. I'm bringing it back across to the heel, and probably up a little bit along the Achilles tendon as well. And again, you see I'm stretching the Achilles tendon as I put it on. And that can actually go all the way up to the back of the knee. In this case, I'm just doing a little bit because of the size of the tape I cut. And that by itself, can be really helpful. What I might do if the fascia, the plantar fascia, the middle of the foot is the main issue, I might take another piece and I might place it across the bottom like that. I might stretch it in the middle, and that by itself would suffice. In my case, I chose not to do that. What I'm going to do is, because the pain is mostly in the middle heel, is I'm going to take a piece and surround the heel, both from the bottom. You see I'm ripping it in the middle and bringing it up on both sides. And then again, I'll put another piece from the back. That's I'm talking about the plantar fascia and the sides. And now I'm going to complete that by surrounding it from the back. So I start from the back and I bring it forward. So I'm really just holding the heel and surrounding the heel, and it feels great. And it's a really terrific way of supporting the fascia. And that's it. That's the basic plantar fascia taping.